Thank you so much for coming to our Spring Policy Consortium. It's a great pleasure to have you all here. Gwen and her team have built a really impressive and exciting and interesting agenda this morning. I'm going to let her go over that. I do want to welcome the president of our board, Dr. Al Benson, is joining us this morning and this afternoon, so I want to thank him for coming down from Northwestern for today. Obviously, one of the people that's practicing genomic medicine in real time, as well as others in the room. This is important to us as an organization because it really gets to a big part of our person-centered care agenda. And for us, that's about getting the right care to the right patient at the right time. And that involves things like shared decision-making, care planning, quality measurement that really matters to patients, as well as the type of care support and navigation support that patients need to get through the world's most complicated and expensive health system, especially one that's based on precision medicine and genomic medicine. I don't think I need to tell the folks in this room how important and how promising genomic medicine is as part of that precision medicine endeavor. We've invested billions as a nation in trying to get to this point of being able to really deliver the right medicine to the right patient at the right time, which is obviously a big part of that person-centered care approach to healthcare. Great potential, not just for the benefits of efficacy, but also for potentially trying to avoid specific side effects for patients by delivering a genomic medicine that is appropriate to that person, as well as great promise for cost effectiveness. Nothing can be more cost effective or cost inefficient than giving the wrong treatment to the wrong patient at the wrong time. Nothing's more expensive than giving someone an expensive treatment or an expensive care regimen that's not the right care for them. It's actually more efficient to take the time that it takes and use the diagnostic tests and the shared decision-making that it takes to try to identify what is going to be the right approach for this patient. Also, the whole idea of value-based payment models. This is an area that's ripe for an approach where if you've got some variation in response based on efficacy or side effect profile or other benefits to patients like avoiding transportation costs or avoiding work disruption. Those are things that certain types of medicines based on your genomic profiles and other aspects of a patient, you could actually have different variances in response, and you could have variation in benefit that are ripe for value-based payment models where you're actually putting your decision at risk, both as a clinician, as a manufacturer, as a hospital, as a patient, as to whether or not you're taking the time and effort it takes to get to the right medicine, the right care for that right patient at the right time. At Patient Advocate Foundation, which is the sister organization to NPAF, we actually like to think of our contribution to that as the navigation support side of it, and particularly in a model of what we think of as precision charity. So we have a program called Case Management, and it really is about, and you're going to hear a lot of that from Dr. Vince, a little bit about that in more detail from Dr. Vince Bonham, so I won't steal his thunder, but it really is about trying to get the right help for the right patient at the right time. It's very responsive to what the particular needs are and the particular problem that patient is facing. And so that's how we approach that particular program. It's very person-centered in and of itself. We actually have, if you look in your folder, we have for many years we've operated it's changed name a few times. It's now known as the Personalized Medicine Care Line. And this, again, is the program that Dr. Bonham will be focusing on. But it really has been our front row seat for our case managers to see what it's like to try to get access for patients, particularly underserved and under-resourced patients, access to genomic medicines and precision medicines in a system that is still highly geared towards standardization of therapy. The current delivery model and the current cost-effective model, whether it's in clinical pathways or formulary design or even through the clinical workflow, is about how to standardize care. How to get, making the assumption that perhaps we can get the right thing to 80% of patients, which is sort of that flies in the face and is the opposite of personalized medicine and precision medicine. So we've had a front row seat to helping thousands of patients try to get access to a medication or a therapy that is based on a genomic profile or other personalized aspects of who they are as an individual, and seeing how complicated the system can be to try to get access to that. It's still even though it's been around in some therapeutic areas for a while, it's still a very new innovation, and I think also a very expensive innovation. And herein lies the rub and one of the great risks, I think, and I'll close with this, and this is obviously the topic of the day. One of the great risks of this technology and this innovation is its potential to also introduce another great disparity in the system. So if we create a system that makes it very difficult for people who are under-resourced or who can't get access to the best clinical centers in the world, or people who don't have the best insurance coverage in the world, if we have this incredible innovative technology that really is about getting the right care to the right patient at the right time, but only a certain type of person based on socioeconomic factors or other factors is able to get access to it in a quality, in a reasonably affordable way, then that can actually make our health disparities and inequities in our health system even worse. So I think that's a bit of a downer, I know, but that's the reality that we face, and we have to try to figure out not only how to create a healthcare system that is person-centered, but using genomic medicine as one of the basics for that, but also how to make sure that that technology is accessible to everyone in an affordable and high-quality way. So with that, I'll leave Gwen to kind of give you a snapshot of the day and the program they've designed, and we'll get the program started. Thank you so much. Great science. Thank you.
Good morning, everyone. I'm Gwen Darien, and I am so pleased to see everybody here today. This is a project that we have been working on for quite a number of years, Vince and I, and I'm so pleased to see the project that is the inspiration for this day coming to fruition. And you're going to hear a lot about that from Vince Bonham. So I wanted to just give a few, and Jamie always says I always forget to advance the slides. I'm trying to remember. I wanted to just give a few overview comments to this, but I wanted to step back and give a little context, because everything that we do at Patient Advocate Foundation and National Patient Advocate Foundation is about closing a gap. And it's always about closing a gap between the people who, between the discovery of new medicine and new treatment and the people that need to access that treatment. It's always about closing the gap between people who are underinsured and people who have phenomenal insurance, although I will say recently our phenomenal insurance has been pretty bad too. It's always about closing the gap and creating a bridge between different communities and different stakeholders. And that's really the highlight of what we're doing here, is that we're really creating a conversation around how we are going to ensure that the fruits of genomic medicine and the fruits of this discovery and development are accessible to everyone. And it's not so, that's not such an obvious point. And I think we'll see that as we hear over the day. There are a lot of different, we have a lot of different presentations that cover a lot of different things, from some of the concerns and the harms of genomic medicine to historically disadvantaged groups and continually disadvantaged groups, to the importance of making sure that we share our family history and that we know our family history. And to the idea of whether genomic medicine exacerbates and actually perpetuates the notion of race, or whether it erases the notion of race and really looks at what people's particular genomic and genetic profile are. So that's sort of just a background on this. And a background to this project, I met Vince Bonham quite a number of years ago when we were on a project on the Advisory Committee for Genetics, Health, and Society. And it continues to be one of the most important projects of the day, which is what we're going to do with genetics, genomics, our health, and our society. And when Vince and I were talking about how to do something and how to capture this experience, when Vince met with our case managers at Patient Advocate Foundation, and you have the great treat and privilege of listening to our 3 case managers over there who are on the ground with people every single day trying to make sure that we close this gap in delivery, healthcare delivery system, and that we really work on delivery reform. We decided that looking at what the experiences were of our case managers with our genomic care line would be an extremely vivid way of showing you what's happening on the front. And then around that, for today, we have a lot of other talks and considerations, from narrative and storytelling to how you activate a community to really talk about their health and talk about their health history. So I wanted to just, I'm going to be brief because I want to get to our panels, but basically what we're looking at today is innovative ways of raising awareness of the potential for genomic medicine to improve individual and population health and alleviate barriers to access. And I think one of the things that's really critical, and it's a theme that will go through this whole day, is that we're not just looking about improving individual health, but we're also looking at how we can improve population health and how we can improve the social determinants of health that go around those population health. So you'll hear a lot about precision and personalized medicine, which you hear a lot about in genomic medicine and genetic testing. But we will not have solved the problem. We will not have moved our health forward if we do not also deal with the larger public health issues. I have only 2 minutes. And so Vince is going next to Bonham. He's going to present preliminary results of his study. And the case managers who are here were part of that study. So our goals are, as always, to bring the patient and provider voices to the table. We always bring a cross-section of people to every policy consortium we do, and everything that we do. That is a hallmark of everything we do, which is building these bridges. And then also explore the challenges, but also look at the solutions in assuring equitable access to health care. And I wanted to, in preparation for this, we did a little survey, and we asked our communities, meaning everybody that was on our list, and we also did it on Twitter. We asked them 3 simple questions. What would you most like to know about genetic testing? What worries you about genomic medicine? And there was a third one, which I lost. I'll find it when I go through it. So genetic medicine, no surprise, genetic testing, what does it mean to me and my family? What can you learn? How accurate is it? There were themes that came up through everything. Accuracy was really important, and also the idea of actionability was really important. Equitable access came up through every question that we asked, because there is a significant concern that this could increase disparities before we actually close that gap. How much does it cost? How much does it inform treatment decision? And the other thing that was that came loud and clear through all of these was confidentiality and safety. And who was going to use that information, and to what end were they going to use that information? And I think that for many of us in this room who have dealt with our own illness or dealt with illness as a family, I'm not so worried about myself. I've talked about being a 3-time cancer survivor everywhere. But I am worried about my family, and I do care about what the impact is down the road on other people who are around me. Then we looked at what worries you about genomic medicine, and unsurprisingly, they're very similar things: privacy, access to health care, risk of increased cost due to genetic disposition. We thought a lot of things were settled, and they are now not as settled as they were before. There's a lot of uncertainty around our protections, our patient protections. Fear that it may segregate the population as opposed to bringing the population together and showing that we're all the same. I think the other thing that's really important to remember, and I've been in so many scientific meetings, as have many of you in this room, is to get too excited too quickly before we really understand what the promise is. And if there's information that's not actionable, there's nothing we can, do we want to know? And that's another question. What do we want to know if we can't act on it? And then finally, the greatest promise, of course, that's the question I forgot. What do you see as the greatest promise of genomics and precision medicine? And I will say we're using precision medicine and personalized medicine a little interchangeably here. You will notice, that there is a glossary, a helpful one-page glossary that's in your folders. And I think in that one we used personalized medicine, but we use personalized and precision medicine sort of interchangeably. And so, of course, everybody wants more effective medical interventions with less treatment, being able to target, as Alan said, a precision charity, but also to target our precision medicine in a precision way, decrease side effects of medication, and I think that's one of the great unknowns is what some of these genomic interventions do, earlier diagnosis and treatment, and understanding the best course of action to take for each individual. So you see, the themes are move from society to individual to family, and they all have the same theme, whether it's what is your greatest hope and what is your greatest fear, and what do you see as the promise.